I need to buy two different sets of needles, one for withdrawing TRT and one for the actual injection. If so, how do I even know that the needles will both be compatible with the same syringe? So to answer your first question is going to depend on personal preference. You do not necessarily have to change the needle after you withdraw and before you inject testosterone replacement therapy. With that said, some do recommend changing the needle after withdrawing medication to ensure that the tip of the needle is as sharp as possible, thereby reducing pain, at least a little. Now, in regard to TRT specifically, because it can be quite viscous, some men prefer to use a large needle so that they can withdraw the medication very quickly. They then change the needle to a smaller size needle for injecting comfort. Now, personally, I withdraw and inject an insulin needle. Insulin syringes, the needle is pre-affixed, so I do not change the needle after withdrawing and before injecting. It takes maybe 15-20 seconds for me to withdraw my dose of TRT with that insulin syringe, and then with it being so small, it's relatively painless. Now, for those that do prefer to use a different needle for withdrawing and for injecting, the best bet is to go for Luer-Lock syringes. Luer-Lock syringes can essentially accept any size needle that is meant to be twisted on to the syringe itself. They have the same standard and they're all compatible with each other, as long as it says Luer-Lock. With that said, when it comes to TRT and really any self-administered medication, your provider should be providing these for you, or at least a prescription with the exact size needles and the syringes that you need for your protocol.